Hey everyone, welcome back to the Power of the W. We're really excited to share this episode. I sit down with Ebonie Bailey. She is a powerhouse advocate for Black maternal health and is a true changemaker in her community. Ebonie is also the owner of a doula service company and a co-founder and chair of the Iowa Black Doula Collective. It's a nonprofit that focuses on uplifting and supporting bipoc families. As a mom of 5, Ebonie brings both personal experience and deep professional insight to the conversation. We talk about her journey to becoming a doula, the barriers she's overcome, and how she responded to a lack of representation by building her own table and inviting others to join. Ebonie talks a lot about advocating for yourself, and we dive into the critical issue of racial disparities that affect women of color. I think this episode will not only be informative, but be very empowering for our listeners. And lastly, we talk about the YWCA Quad Cities free maternal health fair that Ebonie is co-hosting with us on June 14th. We're going to have a lot of amazing resources available for expecting mothers. So let's get into the episode. Welcome to the Power of the W podcast, a space where we inspire, educate, and celebrate the incredible strength and resilience of women from all walks of life. In each episode, we'll dive into the stories, experiences, and insights of amazing women who are making their mark in the world. From personal development and career success to health, wellness, and entrepreneurship and beyond, we're here to uplift, empower, and fuel your journey to greatness. So get ready to embrace the power of the W. Hi, Ebonie. Thank you for joining us.
Hi, I'm happy to be here.
I'm really excited about this conversation. I think it's an important one to discuss and one that I don't think people necessarily are aware of. And I think we should start with your journey. So I guess what inspired you to become a doula, and how did that path into your career, I guess, happen?
So this is a question I get asked all the time. And I say, like, by nature, I am a mama bear. I am like the protector. I am the kid who grew up wanting 100 kids. And so like, it's kind of just in me, right? But when I was in high school, a lot of my high school friends were pregnant. So a very young age, and they would call me. And I'm like, I don't know, like I've never been pregnant. I don't actually know what to do. But I also became an aunt at a very early age. So my nieces and nephews were just a couple years apart. And so because of that, I've always been surrounded around babies, around kids, around pregnant people. So it's an area where I felt comfortable. I have 5 kids. And so I had my first kid when I was in college. Struggled through that with pregnancy and like playing soccer and trying to maintain my scholarship, but also doing some like digging into how do I stay healthy for my child? How do I protect him? How do I protect myself? And like, what does that look like? And so that kind of started the foundation of like women's health, and then figuring out how to navigate the healthcare or the medical system. Because prior to that, it'd be my mom. I'm going to a doctor's appointment, they're asking her questions. They're not really talking to me. But now that I'm pregnant, everyone's talking to me. And I'm like, how do I answer these questions? I'm calling my sister, like, what should I say? Or what should I expect at appointments? So fast forward 3 kids later, I moved from the Quad Cities to Waterloo. And it's the very first time with my pregnancies that I've had a midwife. And the midwife, very first appointment says, how do you want this to go? I'm 7 months pregnant. I'm like, how do you want your labor to go? And I'm like, oh my God, what is this? She has to be new. This is crazy. Why is she asking me this? And I am emotional because I've had to switch providers and like all these things are happening. And she's like, this is your experience, not mine. Like you have to tell me what you want. And I can tell you what is within my scope that I can say, yes, I can absolutely make sure that you get those things. And so again, she just kind of sparked this I don't know, this fire under me of like, what is it that you really want? Because your last 2 births, everyone told you what you had to do. You
Yeah.
didn't always get what you wanted. So it just kind of set the foundation. And I started, had an amazing birth with that midwife and decided that I was not ever going back to an OB. Nothing against OBs,
Right.
but I just had such a good experience it just solidified my decision to only practice with midwives and to make sure that as many people, pregnant people that I came in contact with had not necessarily a similar experience to mine, but a healthy and a safe experience.
Or even, yeah, to just know to ask those questions or to have that discussion of like, this is how I want this to go. Because
Right.
I mean, with my first child, I didn't, I just was like, all right, like here we go. Like it wasn't, yeah, I didn't have that experience. So
Because you expect the providers to take care of you,
yeah,
right? They're
yeah.
the experts, but they're not the experts of your body.
Hmm.
You are the expert of your body. And
Yeah.
it took me a long time to learn that if I say that I have a pain, I'm telling you that this is not normal for me. I don't care if you think it's normal because I'm pregnant.
Right.
Telling you it's not my norm, and I need you to address it. I need you to give me tools and resources to help me address it. Don't just ignore what I'm saying. And that's what oftentimes happens. So I can remember after I had my third, I had mastitis, had never had mastitis before. And I went in, it was not my 6 week checkup. I literally didn't even make an appointment. I just went in at 4 weeks postpartum. And the midwife was walking through the lobby, and I saw her, and I was like, Catherine, I need help. And I just started bawling. I had my baby with me, and I'm just crying. And she was like, hey, come to the back. I laid on this lady's lap and cried and couldn't find the words to explain to her why I was crying. I was like, something just doesn't feel right. And also, like, my breasts hurt really bad, and I don't know what to do. She's like, let's look. And immediately, oh, you have mastitis.
Yeah.
I'm like, am I dying? Like, I don't even know what
Yeah.
that is. What's
Yeah.
happening? Can I breastfeed?
Right.
And it was simple. It was simple for her to say, I hear you. I see you. You're wetting up my pants, and I don't even care. I'm talking about bawling like a toddler
Yeah.
because I was scared and just emotional and didn't know what to do. I didn't have the resources.
Yeah. Um, so you've been doing this for a while. So I guess when did you like finally say, you know what, this is my calling, like this is what I want to do.
I believe that there are things that happen in your life that put you like in a path where you can't turn back. So I worked for the government for 8 years as a project manager. Like that's what I'm going to do. I'm gonna be a project manager. It wasn't filling my spirit. It wasn't filling my soul. It just was a job.
Yeah.
Walked into work one day and I quit my job. And my husband said, we are in a really good position to where you can figure out what it is that you want to do. What is going to make you wake up every single day and feel like you're making a difference and makes you feel good? What is that? You got to figure it out. And once I was able to, my very first family that I supported she's like 18 years old. And she said, I had no idea how this baby was going to come out. And I was thinking, how did you not know that? Right. But also just seeing the confidence boost that it gave her to be able to look across the room and see me and say, you're doing a good job. Like you got this. Right. And I still communicate with her. Her child is 7. And so it just like it made such a big difference along my journey. And the way that it made me feel was this is how I'm going to plant the seed in several different families throughout the state, throughout the country. And it may not be my job to water those seeds, but it's going to be my job to plant those seeds. And I take that very serious. So I was like, this just feels good. I never feel tired or like, oh, I can't believe I have to go to
Like it's
someone's.
a job.
Yeah, it
Yeah.
doesn't feel like a job. It feels like I feel honored that you would allow me to be in your space. I feel blessed that I have enough people around me that are sharpening my tools at every single turn and challenging me to be better so that I can show up for somebody else.
And you haven't looked back, obviously. So I mean,
Not at all.
you obviously made the right decision. Um, so there's kind of a growing awareness of the need for birth workers of color, but um, from what I understand, there's still significant barriers that exist. So, did you face any challenges on your path, to entering this field?
Yes. So thank you for asking the question, like creating space for it, first off, because that doesn't always happen. But as a woman of color, whether you're becoming a doula or a midwife or a chiropractor, an OB, like anytime you're entering a profession that is predominantly not led by people of color, there are barriers, right? There are people questioning your skill set, questioning where you decide to take your training, like making you feel like, am I enough? Do I have to know everything before I can support a family? No, because just like these providers who've been doing it for 30 years, something will come across their desk or someone will come into their room and they have to seek out advice and ask questions. And sometimes I feel like it's Dr. Google. Don't quote me on that, but I think it's Dr. Google. And so like it just it's a part of life. I'm born Black, right? So I've been dealing with this my entire life. I don't actually know anything different. What I know is people challenging me, second guessing me having to prove myself worthy of being in a space. Um, and really that's what formed the collective. As I said, no more. I'm not asking you to be at your table. I'm gonna build my own damn table in my own house, in my own way, create my own rules. And we're going to show you better than we'll ever be able to tell you the difference that we're going to be able to make in our own community.
Um, so I guess what advice would you give if we have someone listening here who's a woman of color and maybe they want to enter this field, but they are hesitant because of those barriers? What advice would you give to them?
I would say seek out others who are in the field that you want to be in. Create open lines of mentorship, guidance, sisterhood. Those things will only aid you in building confidence, right? So the foundation of our collective, any of the doulas that you talk to in the collective will say, we genuinely care about each other. I care that you're stressed out in your relationship or at work, or that your kids are making you feel like, am I going nuts? Like, we care. So we have those conversations first. How are you doing? How did your daughter do on her test? I know she had a math test and it's not her strongest point, right? Like,
Yeah.
how can we rally around and be supportive of each other? And so building that community is what will help you withstand the test of times. No one should ever have to walk into these spaces alone, just like it's not set up for you to parent alone. You need a village. And sometimes that village is not your immediate family.
Yeah.
That village is your neighbor, your church member, someone that you met at the dog park or whatever.
Yeah.
They become your village and they become the family that is not blood, but still just as close, just as helpful, just as caring as your actual like biological family.
Yeah, and I mean, having a village, I mean, it makes a world of difference. It really does. Um, so, statistics show that maternal and infant mortalities for BIPOC women are significantly higher compared to white women. Can you talk about why these disparities exist and how do you see them play out in your work?
So it is systemic racism, it's systemic bias, it's social determinants of health. It's a lot of different things, right? It's chronic stress. It's definitely medical mistrust. When you are being told over and over again that what you're feeling, what you're thinking, what you're experiencing is not factual, it's mistrust. When you are in a space in the most vulnerable time of your life and there's no one that looks like you, it's scary. It is really, really scary. You feel like, can I be my authentic self? Can I ask a question in the way that feels comfortable for me? Or do I have to conform and ask the question in a way where the receiver feels comfortable? That's oftentimes what happens in our medical system. That is why Black women specifically, but women of color, are dying at a much higher rate, right? It's the stress of working two jobs to make sure that you can provide. It's not being able to find adequate housing or just dealing with the day to day. And specifically in Iowa, majority of the BIPOC individuals that are in Iowa, I call them transplants, meaning not from Iowa.
Yep.
They're coming in because they go to University of Iowa or go to UNI or something, right? They're working at John Deere, they're working at Alcoa, they're working at the Arsenal. They're coming in for a better opportunity oftentimes. I also believe that Iowa is a state that's like quicksand. Like you get there and you got to like fight your way out before you can move somewhere else, right? So you come for the opportunity and you're like, I don't really want to be here, but It's relatively safe. Um, Cost of living is, doable. So you can try to figure some things out. It's not a huge city where you're driving 2 hours to get to work. You know what I mean? So
Yeah.
it's easy sometimes to just kind of get stuck at it and stay. But when you think about healthcare and you think about how the lack of diversity in healthcare, the lack of access. I was also a hospital desert state. And so when you're having a high risk pregnancy and you have to drive an hour and 30 minutes, which means you have to take off work and then hope that the providers are on time so you're seen on time so you can get back home, it just creates all of these additional barriers that others don't have to experience. Not at the same rate, at least.
Right. You talked about the statistics of Black women, dying from these pregnancy related things. And it's alarming. And behind those numbers are real people that we're talking about. And how do you carry that weight in your work?
So we carry that rate different, and it's real weight. It's also not weight that you pick up and you put down. We're talking about my neighbor, my cousin, my sister, my church member, like real people with real faces that are at a higher risk of losing their lives and their child being raised by who, right? Sometimes a dad, sometimes a grandma, an auntie, community members stepping in, or sometimes they're going into the system. These are not just weights that we don't pray about, that we don't try to create change for. And that means hypertension, that means high levels of awareness and stress for us. Anytime I see someone that's pregnant, I don't care where I'm at, airport, gas station, grocery store, I'm like, hey, do you have a doula? Especially if it's a woman of color. Do you know what a doula is? Do you know why you need a doula? Let me offer you just a birth plan template. I'll set up a 15, 30-minute call with you and walk you through it for free because I value your life. And I know that you choosing to be pregnant and expand your family means that you are putting your life on the line at a much higher rate. And it's scary. Like it is really, really hard. But I also think that we turn that muscle memory, we turn that weight into power. It makes people like myself say, I'm going to start a nonprofit and we're going to do something different in a predominantly white state. We are going to stand out and we're going to create change. And we're going to bring people alongside of us and we're going to go the extra mile to provide education to providers and stakeholders and community people who don't understand why we're here and what we're doing. And so we carry the weight, but the weight is not invisible. It's invisible to others, but it's not invisible to people who are actually doing the work. So when I see a fellow doula who I feel like is struggling, I'm like, hey, I got you. What do you need? Do you just need some time off? Do you need me to step in and meet with your client so that you can figure out what next steps are? Especially when that doula experiences a family that has a loss, we feel that loss too. And we figure out how to rally around that family. What does that look like? Do we need to come in and help maybe clean out the baby's room for you?
Yeah.
Those are things that people don't necessarily recognize that doulas take on. We're not just there to show up for labor and delivery.
Yeah.
Like we know these clients, we know what they had for dinner, we know their favorite flowers, like we know them on a much intimate level than a provider will ever have the opportunity to know because they just don't have the time with the volume of people that they're seeing.
You talked about Iowa, and I was going to bring that up because obviously Iowa is a predominantly white state. Um, so I was going to ask, with that, did that um, kind of like provide a sense of urgency for you to do something, and also talk about your nonprofit because I do want to talk about that.
I don't know if it provided a sense of urgency. No, I think what it made me recognize is one, how do we create a safe space for BIPOC families and doulas? Um, One, right? Like to start. And then secondly, how do we make sure that the non-BIPOC individuals who want to be allies, that they also have space to do that? Like we're not in a position where we can only just care for ourselves or just think about what we need and not think about the support that we're going to need from others. So we have a ton of allies who show up for us and who have been showing up for us for almost 5 years in various ways. Whether that's, hey, Ebonie, I'm going to take this call because I feel like it might be triggering for you, or I can create that flyer. Not only will I create it, I'll print it, I'll pass it out, I'll do whatever it is that you need to help you all kind of rise to the top and be successful and support as many families as possible. Um, the state of Iowa has been, it's been good to the collective, honestly, with the amount of stakeholders who are like, hey, I see you, I hear you. And not only do I see you and hear you, and I'm telling you, I'm willing to put my dollars behind it. I'm willing to cut you a check because I see what you all are doing from the sidelines. Or like as boots on the ground, right? Like as a grassroots organization, attending events, throwing community baby showers. And we want to get behind it, but we don't want to be at the forefront of it, right? Which is, it's sometimes okay to say, let me write my check for people who are already doing the work
Right,
because
right,
I don't have to start a new organization or start a new initiative when
right. If
people
when there's
already.
something that already exists, let's just support that cause. Yeah.
Yeah.
Yeah. So talk about the collective for people who might not be aware of it. Talk about like the services and everything that you guys are doing.
Yeah, absolutely. So the Iowa Black Doula Collective was founded back in 2020, where our mission started out was to just kind of service Black women, Black families, right, through labor and delivery, postpartum period, fertility. Since then, we've expanded to support the BIPOC community. So we're training BIPOC doulas, supporting BIPOC families. That means if an individual is wanting to become a doula, we alleviate the financial burden of becoming a doula. So we cover everything. We have scholarships to become a doula. We have what we call the doula bag, and it is literally a backpack full of supplies that you would need to support a family throughout the pregnancy, labor, delivery, and postpartum. We have two virtual support groups. One is a breast or chest feeding support group that is taught by a Black IBCLC. That group meets on the first Tuesday and the third Tuesday of every single month. And then we have a mental health group that is very, very popular. It's taught by a Black trauma therapist who acts as a coach. She gives journal prompts. They meet the second and fourth Wednesday of every month. It's all free. We encourage families to come, not only just to learn from the facilitators, but also to help build community. So it's really cool when a family comes to the moms group and they're pregnant and they're like, I'm doing July. And someone else is like, oh my God, I'm doing July too, right? Like our due days are 2 days apart.
Yeah.
Uh, and I'm like, yeah, so offline, you all should connect, like go for a walk
Yeah.
in a similar area or talk about your experiences to, again, build the village. We also do 3 to 4 community baby showers in different areas every single year. We're doing a community baby shower in June on the 21st at St. Luke's Hospital, where we're also doing our not community, our doula training. We give out, car seats and playpens, and there's also education. So learning about what a doula is, learning about safe sleep, learning about warning signs in pregnancy and the immediate postpartum period, and then also learning about how to advocate. That's a huge thing that happens. I feel like at a very early age, we're taught to like, don't ask too many questions, right? Like, don't
Yes.
touch me,
Yes.
don't do this. And now, as an adult, when you're needing to ask questions, it's kind of like, well, can I? Like, is that okay? So we're teaching a lot of that within the collective. The other thing that I'm very proud of is that all of our doulas are also BIPOC entrepreneurs, right? Like everybody runs their own business. They do not work for the collective, they're their own entities. We just are like a house for them. Everybody has their own room, they have their own, we're just the
Yeah.
building. And so that's awesome because we have individuals who would have never thought, I'm going to own a business one day. And so just to share that with their families, their children, seeing them, during their taxes or meeting with the clients or working on a marketing strategy is powerful and it builds the momentum.
Um, I think there's people that either A, they don't know what a doula is,
Mhm.
or I think when they hear the word doula, they think, oh, it's just like someone there that's like there to be there, like emotionally support during the labor, and that's it. Clearly, as we've been talking, it's much more than that. Um, how can doula care transform outcomes for women, particularly women of color? And like, do you have I'm sure you do, but like, do you have a story that sticks out to you that kind of illustrates that impact?
Yeah, absolutely. So as a doula, we are there through conception, right? Um, in an ideal world, an ideal space, you would hire a doula anywhere between 12 and 14 weeks. And then they would be with you all the way through. Our motto is that you're stuck with us for life, but they would be with you through your 6 week checkup.
Yeah.
And then you can try to disappear. We're going to find you, but you can try to because we care, like we love
Yeah.
our clients. We love them so much. But a doula is talking to you about nutrition during pregnancy, postpartum period, mental health. Do you have a therapist? Are there things um, in your past that may trigger you in labor, right? And how do we work through that during pregnancy so that you have a coping mechanism or you're not as triggered during labor? We're also help navigating with community resources. Do you have a food or housing insecurity that we can help you with? Those are all things that we're doing in the prenatal period. And then, of course, we're there throughout the entire labor and delivery, whether that's 2 hours or 3 days, because sometimes that happens, especially if it's a family that's induced, it can just take a little bit longer. But I can't talk.
It's okay.
Statistically, doulas are proven to help families have healthier pregnancies, healthier deliveries, happier outcomes. Um, and that's one thing that doesn't get thought about is that you walk into labor in your room 202, right? Once you have your baby, you get moved to the postpartum side and then you go home. And unless you have another baby, nobody else is seeing you, thinking of you like that's the end for you, right? That's it. You are not 202 to us, right? You are an actual person that has feelings. And so when things show up afterwards, we're still there. We're one of the only constants throughout your entire pregnancy and postpartum period. On that day of labor and delivery, everyone is a stranger. The nurses are a stranger. You may or may not get the provider that you've been seeing, depending on who's on call. That's it. So the people that you bring with you to that environment are the people that are your village. We are
Yeah.
the people that are familiar to you.
Yeah.
Um,
And those people can really make or break your experience.
yes, absolutely. Yes, and they can change the outcome, right? You're holding stress, and so now you're not dilating because you have a nurse that's rude, or you
Yeah.
have a provider who's adamant about that you need to use Pitocin, or you need to do this, or you need to do that, and you're like, I really don't want to do that, and I want to just be able to trust my body. That is when a doula can come in and help advocate and say, hey, like, I don't know if you all had the opportunity to review the birth plan, but this is the wishes of the family. Like, how do we work together? Right. So we're not there to tell you what to do. We're there to work with you, but the family is our primary focus, the health of that family, not just physical health, emotional health, spiritual health, like mental health, all of that is our primary focus. So that's what makes a doula useful. That is why our unique, and that's what helps create these better outcomes. So when you have a doula, you're also less likely to have a C-section because we know comfort measures. We know how to move the baby to help with better alignment. And specifically within the collective, we do a lot of continuing education, a lot. It's required. Um, Things are changing, right? We want to be able to keep up with those changes.
Um, I guess what can be done to try and help eliminate these racial disparities?
I think it starts with first listening. Regardless who the person is, when they tell you that they have a concern, you have to trust that. You have to believe that. And then you have to act on it. Giving people the autonomy of their body, um, and the courage and the strength to be able to use their voices. But I also think specifically in Iowa, we have to diversify the workforce. Like, I don't know what efforts are being done to do that or are happening in different hospital settings or different healthcare environments, but it has to be like your healthcare, your hospital should match as closely as possible the population in which you're serving. And in a lot of ways, it doesn't. And so that would create a lot of change and help support a lot of trust. I would also say support the grassroots organizations who are doing the work. Like, we're here to do the work. We have the capacity to do the work. And stand behind us. Don't stand in front of us. Don't get in our way. You're either going to stand on side of us and help us walk through it, or you're going to be behind us and kind of push us forward by using your voice as well.
Yeah, so that was kind of my next question, for listeners who are listening to this, and want to help, but aren't sure how they can do. So, like, what can allies do to help support this? I mean, obviously, probably one, support organizations like yours, but what else can they do?
When you learn something, share that information. When you're in an environment where you know that something is happening that should not be happening, have the courage to speak up. And sometimes they don't. And especially for L&D nurses, where they're like, I don't really think this should be happening, but I'm
Mm.
not going to say anything. Because when you don't say anything, that family has to bring that trauma home with them. Not only the birthing person, but also that baby brings the trauma home. That doula brings the trauma home. The partner brings it home, right? And so it just creates this trickle down effect, and you get to move on to the next room. We don't always move on the same way. So speaking up, especially when you see that something is wrong, supporting organizations, and support doesn't, I mean, financial support is amazing, right? Allows us to
Right.
do our work,
Right.
but also sharing posts,
Yeah.
social media, everybody's on social media, share the post, engage in the conversation, challenge your own people that are around you, your own family members with their thoughts, um, and kind of just spread positive, evidence-based, factual information. And that's going to help create a lot of change. And if you are a provider, you should be advocating for all of your patients to have, all of your clients to have a doula. You should be advocating for your CEOs and administration to say, hey, how do we get more doulas in this hospital? Because it actually saves the hospital money as well, relieves stress from L&D nurses and providers. And it's going to make sure that community-wise, that families are healthier and happier.
Before we wrap up, I do want to talk about the maternal health fair.
Mhm.
So the YWCA, we're having a maternal health fair on June 14th from 1 o'clock to 4 o'clock at our location in Rock Island, and you are hosting it with us. It's going to be free to anyone in the community. We're going to have a lot of different resources there. What's your hope for that fair?
I hope that hundreds of people show up and we're like, oh, sure, we weren't ready. In some ways, right? But I
Right.
also hope that people feel welcome, that they feel comfortable in the space, and that they walk into a space where they can see themselves.
Um, so we are going to have some healthcare providers there who's going to offer parenting, but also pregnancy topics, presentations on that. I'm trying to think of all the things we're doing now. Of
There'll
course,
be a maternity shoot is going to be
yes.
there, a yoga class, prenatal massages, there's chair massages that are happening. Lots and lots of resources and goodie bags. We were actually just texting about the goodie bags right before this. I'm excited about the goodie bags. Yeah, so come out, like, get the things that you need. You'll have access to diapers and wipes. And again, this is how you build your village. This is how you build community, is getting out there. And I would say for providers, show up. People need to see you outside of a clinical setting. When they see you outside of a clinical setting, you feel more human. And so when they see you at their prenatal appointment 2 weeks later, they feel more comfortable being like, oh my gosh, I remember seeing you play this game, or I remember seeing you at this event, and I was scared to say hi, but it was cool to see you outside of this setting.
Yeah. Ebony, anything else you want to add or say before we end?
I would say that the world is wild right now, but be kind. Like, everybody's trying to figure it out. We're all taking it day by day. Smile, say a kind word. Like, if you don't have something kind to say, just, as my grandma would say, like, keep it to yourself,
Yep.
right? Like, it doesn't always need to be voiced. But also find your strength, find your inner strength for those who feel like they're being silenced, who feel like it's really hard for them to have a voice and advocate for themselves. Reach out to us. We'll help you find your voice. We're good at that. But also know that we see you, we hear you, we appreciate you, and we understand the struggle.
Awesome. Thank you so much for coming on to talk to us. And again, everyone should come check out our maternal health fair. There's more information on our website. You can also download your free ticket now. It's absolutely free to go. And again, Ebonie, thank you so much.
Yes, thank you.
Thanks for listening to the Power of the W podcast. If you like what you heard, don't forget to hit subscribe, leave a review, and share this episode with a friend. For more updates, follow us on social media or visit our website at www.ywcaqc.org. We'll catch you next time right here on the Power of the W.